published back in March of 2009. The NCRP report was an update on the previous report published back in 1982, which is the NCRP 93, which most of us are familiar with when we were going to graduate school with this pie chart. The new pie chart is slowly migrating into the textbooks. In this pie chart, basically an update of the issue about the radiation dose to the US population from a variety of sources. The new pie chart basically indicated that the medical exposure to the US population has increased almost from 15%, and now it occupies almost half of all the radiation US population gets in the annual year. If you look into more detail, looking exactly only on the medical exposure, and in this pie chart basically explaining the percentage of procedures done in the US, and this is based on the NCRP report, and it's a snapshot data back to 2006. I was one of the members of the NCRP 160, so we looked at a variety of sources, and there's a whole talk which I gave last year which has the details of for all these components. Just want to briefly explain here. The total number of procedures done in the US in 2006 was close to 400 million procedures, medical X-ray imaging procedure for diagnostic only, not radiation therapy. 400 million procedure, out of which CT occupied only 17% of the procedure, which translate to 62 million procedures. However, that translate, if we take into account the radiation doses and the effective doses for different procedures and combine what is called as collective dose, the CTs occupies nearly 50% of all the medical radiation exposure, this component. That's come to close to 1.5 millisievert per capita. If you look at the number, estimated the number of the procedures along with the